13. Provisional diagnosis of unilateral foul-smelling nasal discharge in a child is option A. Foreign body nose, option B. Atopic rhinitis, option C. Chronic rhinosinusitis, and option D is adenoid hypertrophy. So the correct answer here is option A. Foreign body nose. In foreign body nose, patients may present immediately if the history of foreign body is known. If it is overlooked, the child presents with unilateral nasal discharge, which is often foul-smelling and occasionally bloody stained. And there is a dictum that if a child presents with unilateral foul-smelling nasal discharge, foreign body must be excluded. Here you can see the foreign body in the nose. Next question. Question number 14. Pulsatile tinnitus is seen in option A. Meniere's disease, option B. Otosclerosis, option C. Glomus tumor, and option D is noise-induced hearing loss. So the correct answer here is option C. Glomus tumor. Glomus tumor is the most common benign neoplasm of the middle ear. The tumor consists of paraganglionic cells derived from the neural crest. In glomus tumor, tinnitus is pulsatile and of swishing character, synchronous with pulse, and can be temporarily stopped by the carotid pressure. Next question. Question number 15. Examination of nasal vestibule is done by option A. Retracting the tip of nose by examiner's finger, option B. Using nasal torticolum, option C. Using Killian's nasal speculum, and option D. Using flexible or rigid nasal endoscope. So the correct answer here is retracting the tip of nose by examiner's finger. Next question. Question number 16. Cottel's test is done for option A. Olfaction, option B. Nasal obstruction, option C. Humidity, and option D. Cranial atresia. So the correct answer here is option B. Nasal obstruction. Cottel's test is used to test nasal obstruction due to abnormality of the nasal valve. What is done in this test is the cheek of the patient is pulled away from the midline. If there is any obstruction at the level of nasal valve, then this test opens the nasal valve and increasing the airflow from that side of the nasal cavity, and thus the symptoms of the patient improves. Similarly, we need to know about the Cottel's line. This is a vertical line between the nasal process of frontal bone and the nasal spine of the maxillary crest. It divides the septum into anterior and the posterior segment. Here you can see this is the Cottel's line. Similarly, there is a classification called the Cottel's classification of the dilated nasal septum, which classifies the DNS into simple, obstructed, and the impacted. Next question. Question number 17. Russell's bodies are seen in option A. Rhinosporidiosis, option B. Atrophic rhinitis, option C. Rhinoscleroma, and option D is sarcoidosis. Russell's bodies are homogeneous eosinophilic inclusion bodies found in the plasma cells, and this is a feature of option C. Rhinoscleroma. Rhinoscleroma is a chronic granulomatous disease caused by gram-negative bacillus called Klebsiella rhinoscleromatis or Frisch bacillus. It is also associated with presence of Mikulicz cell, which is large form cells with a central nucleus and vacuolated cytoplasm containing the causative bacilli. Next question. Question number 18. Gerlach's tonsil refers to option A. Nodules near lingual tonsil, option B. Nodules near palatine tonsil, option C. Nodules near tubal tonsil, option D is nodules near pharyngeal tonsil. So the correct answer here is nodules near tubal tonsil. The tubal tonsil is one of the four main tonsil groups comprising Waldear's tonsillar ring. The tubal tonsil is very close to torus tubarius, which is why this tonsil is sometimes also called the tonsil of torus tubarius. It is located posterior to the opening of eustachian tube into the nasopharynx.